Okay, I think we'll go ahead and get started. I enjoyed this conversation so much, I decided to pull you guys together again. As you all know, I'm Kirk Williamson. I'm a senior policy analyst at Duke Margolis. And so I'm really excited to be here with you guys today. And just as a reminder, I'm here as a neutral facilitator, not to weigh in personally, but just to keep us on track, make sure I'm noting the time and keeping us all generating ideas and getting towards next steps. So as Hammy mentioned, there are two purposes of this small group session. One is to get your feedback on the principles. This is kind of your last chance opportunity to kind of weigh in, give last thoughts, make sure this is reflective of our previous conversations. And then the second half of this discussion will really be about turning these principles into action. So what are some next steps for the council to sustain this work going forward? So just like last time, I'll share my screen and I'll be taking notes virtually so you can all see what I'm typing. And we'll also have somebody read out from our small group discussion. Merritt, you did it last time. Don't want to put you on the spot again. Does anybody else want to do it? Happy to have Merritt do it again, but does anybody feel compelled? No. Merritt looks like it's going to be you again. Do you mind reading out again?
Sure, I can do that. Just help me with the notes is all I ask.
Yeah, of course. And I'll share my screen again when we get back into the larger group. So you can also follow along on that.
Sounds good. Thank you.
You're welcome. Okay, so maybe it would be helpful for everybody to go around the room really quickly and just state your name and then your affiliation. So maybe I'll just call on people. Andy, do you want to go first? Okay, maybe Lynn or
I'm sorry. I'm sorry. I couldn't figure out how to get off mute because it went to the screen. I'm Andy Ellen with the North Carolina Retail Merchants Association. Thank you, Kirk. I'm sorry for my technological difficulties.
No worries. All right, Tina. Okay, go ahead, Lynn.
My name is Lynn Pierce, and I'm the executive director for the largest rural food pantry in Southern Elements. We're called Southern Elements Family Empowerment.
Great. Tina.
Good morning. I'm Tina Gordon with the North Carolina Nurses Association.
Great. Merritt.
Good morning, Merritt Sechel, and with the North Carolina Medical Society.
Great. Julia.
Good morning. I'm Julia Lurch with North Carolina Medicaid.
Great. Steve.
Yeah, Steve Lawler with the North Carolina Healthcare Association.
Great. And Senator Woodard.
Hey, Senator Mike Woodard.
I'm sure you all know him. All right, so I'll go ahead and start sharing my screen. Can you all see that okay? I'm not sure if that did it. Okay, let me try it again.
Not yet.
All right.
There we go.
Is that better?
Yes.
Yeah, I can see it. Okay. I would like to see all of you. So let me get this back up. Have you all had a chance to review this document ahead of this small group discussion?
Yes.
Yeah, okay. Any initial thoughts or reactions? I'll just note, we thought it would be helpful to provide a preamble at the beginning, since many of you discussed like not wanting to rank these and kind of providing a frame for people when they read these principles of how they were developed and what the council is really trying to achieve through these principles. So I'll just note that we drafted a brief preamble. And I was happy to see some of your recommendations incorporated into these principles. So maybe we'll just go around the room and see if there are some initial reactions to anything that was that's on these guiding principles document.
I would just echo what you said, Kirk, that it does look like some things that we discussed were adopted or at least put in, and some things the other groups discussed were as well. So I think it's nice and broad, and I think it captures a lot of the thoughts, and I hope that it will be enough to develop some type of across the aisle consensus.
Great. Anybody else? Do we feel pretty good about this? Does this reflect the discussions we've had so far? Is anything missing? Don't want to recreate the wheel, but I just want to make sure that everything's here and you all agree on these.
This is Steve. I mean, I think these are, these are reasonable reflections of our conversations. I think that these would be consistent with what, hospitals and physicians and other folks that are saddled with the responsibility of caring for folks would say are important.
Okay. Great. Anybody else? Do we feel like these capture everything? Would we like to see something added or nixed? If not, we can move on to next steps. It's great if everybody feels good about these.
So question in regards to taxpayer dollars. Do we want to be more, so that bullet, do we want to be more demonstrative in regards to, maximizing, federal dollars or, any, federal funding when possible? I mean, we're not sure what the new administration will be doing in regards to incentivizing non-expansion states to expand.
Mm-hmm.
So I mean, I just raised the question as to whether or not we should be a little more demonstrative, where we say, should prioritize, rather than I guess optimizing is okay. I was gonna say maximizing or, I mean, other, I would look to other members of the group, just to, get their thoughts in regards to just, really, I think being resolute and in regards to, looking for, federal dollars to support this program.
So kind of above and beyond, including optimizing federal matching funds where possible. Are you thinking that's too narrowly focused on expanding Medicaid, or?
I think that's too focused on expanding Medicaid. I think any dollar that the feds make available to support healthcare in our state, we should go after.
So is the issue with the word matching? So should it just be federal funds instead of federal matching funds?
Yeah, because I think, Julie, I think that could be interpreted as being limited, that you're only going after, a certain group of funds that are available. So, I would just say, I mean, and I ran a hospital in a rural community. So, our mindset in a rural community is if we could, claw dollars to support healthcare in that community, we did that.
Okay. How do we feel as a group about removing the word matching? Does anybody disagree with that?
Well,
No?
I want to make sure I just want to make sure it's reflective of Steve's comment.
Mm-hmm.
I think that's accurate, and I think that expands kind of our horizon in regards to where we believe that there may be opportunity and our eagerness to go after that opportunity.
And I don't know, Steve, just to piggyback off of your point, I don't know if you'd say by optimizing, acquisition of federal funds where possible, or utilization of federal funds where possible, something, we're missing a word, but I get your point.
Yeah.
Okay. Okay, so
optimizing is kind of a squishy word to me. I mean, maybe securing or optimizing and securing. I mean, I get what of having optimizing in here is, because that implies to me the leverage. But I think to Steve's point, and it's a good one, is when things are available, making sure that we've got the policies in place to go get them, even if they're not matching funds. So yeah,
and Senator Woodard, I like that, and maybe So let's think about the order of the words, and Kurt, not to be picky, I would say secure and optimize, because optimize is something that happens once you secure the dollars.
Agree.
You took the words right out of my mouth, Steve. I like securing and optimizing.
Okay.
Do we need the where possible? And I wonder, I mean, we could go, if you wanted to go further, we could talk about removing barriers, because there are, I guess, just from being in the department, there are some barriers to at least the DHHS of quickly securing available federal funds.
Sure.
What do you, can you amplify that, Julia? I'm not sure I understand what you're saying. Like what barriers and what you're talking about.
Trying to come up with a good example. I mean, federal, my understanding is, and I'm not in the finance section, but you know, our use of federal funds also requires appropriation by the General Assembly. And you know, that may not be something we could change, but it can be a barrier to add additional steps to securing federal funds. I don't want to push it too far, because you know, obviously there should be controls over, there should be government controls, but so I don't know if there's a line we can.
What about the word feasible? Where feasible? Maybe.
Yeah, I think that's fine. I mean, it's just a nod to it all has to work, and that's kind of what Julia's saying too. I mean, checks and balances. I don't know, Julia, you speak up, but that would seem to catch it.
Yeah, I think that works.
Okay. Okay, so do we all feel comfortable about the wording of efficient use of tax dollars now? So any solution implemented should prioritize the efficient use, excuse me, of payer funds, of taxpayer funds, including by securing and optimizing federal funds where feasible. Okay. How about the rest of the list? Strengthening rural communities, we added reducing disparities, behavioral health coverage, supporting the business community, and then we have just additional considerations for access, since some of you noted that it might be outside the scope of the council, but it's tangentially related. Are there any other considerations for access we should consider beyond what you see listed here?
Can I put Andy Ellen on the spot and ask Andy, in the bullet about supporting the business community, is there any other language that you'd like to see there, or just leave it broad? Or I'm just curious your thoughts.
So healthcare coverage. I think that's a pretty good broad statement. I mean, in their, the only thing I would say is maybe, and this may be getting too far in the weeds, something along the lines of providing access to additional healthcare options. And I don't know if that's, or health insurance type, because I think, you know, you look at some of the things that people are doing creatively to try to provide health insurance to their employees, whether that be, you know, HSAs, FSAs, high deductible plans, small group, large group, self-insured, you know, those sort of things. But that may be getting too broad and too in the weeds. And I would almost, I'm circling back on myself, I almost think you sort of have, you keep where you are right now.
Okay.
I talk myself out of it, as Senator Woody sometimes.
You know, I mean, that's a good point. I mean, I do think that's probably a policy versus a funding, because a lot of the, once you get outside the ACA open market, it's probably more policy to create flexibility. But I think that's like-minded thinking for sure.
Yeah, I agree with that, Steve. Thank you.
Yeah.
You agree? Okay.
Yeah.
All right.
Thanks, Andy. Appreciate it.
So if there are no other comments to the principles, maybe we can talk about transitioning these principles into action, and how to sustain this work going forward. So do you all have ideas, after reflecting on these past meetings, what are ways or opportunities that we could achieve these principles, or that the governor and the legislature together could work towards moving these principles into action. And it could be a number of things that you all heard, or Medicaid expansion alone. This is up to you.
I mean, this is Steve. I mean, as I think about this, I mean, I think that, that this is like any, like developing any business plan. I mean, I mean, I hate to, make it that, kind of business centric, but, realistically, anytime you take something on, it has to, it has to have, a plan with some objectives, and then, kind of the key elements to make that work. So, I think coming out of this, perhaps, an action strategy is, the development of the framework of a plan where, we come up with, or the work yields, several swim lanes, for us to, kind of, then develop some action steps within. So if one of the swim lanes is, is to, seek and develop, affordable coverage plans for, for small businesses, then, that's a lane that we kind of then develop from a regulatory perspective, and then a, operations perspective, how that would work. Or if it's to extend coverage to North Carolinians without healthcare coverage, then it's, what are the tools within the toolbox, and then what are the action steps to kind of get there. So I think about, what are the next steps? It's developing a framework for, for all of us to kind of work on. And without that, then, I think what we'll do is we'll feel good about spending, 10 hours together, and, listening to people exchange good ideas. I mean, I've got, great appreciation and respect for people that have been part of this, and it's been, privileged to listen to their thoughts. But, I think unless there's a framework that we can build on over time, then this will be a shelved effort.
Do you think that these principles, they don't provide a framework?
Well, I think you can, but, scroll back up.
Yep.
I mean, I think out of those principles, you could almost batch a few of those together to, create a more simplistic, and I think, anytime you take this on, simplicity becomes, a thing of beauty. So, I think being able to take, kind of this list, batch things together, and then use that as the framework for the plan, may
Okay.
be the path of least resistance and success.
Okay, that makes sense.
So can I just ask one other question around this, and then maybe again, this is getting too far out. As I read the documents that we were sent this week, I almost wondered, do you need to have something that references within the parameters of federal law, and I think about like the pathway to association health plan that, is referencing is in litigation currently, and that the Biden administration may pull back on the Department of Labor rule that allowed for that. So that may not be a possibility any longer, and or things like a work requirement for Medicaid, that if you did expansion, the work requirement, how do you navigate some of the legal boundaries that we may be under in trying to find this program that's successful? Again, that may be getting too far afield. But I think that's something we can all come up with ideas, but if it's not something that's going to meet federal or state muster, legal muster, that part may be all for naught.
Okay. So there's a sense that the council should be explicit in acknowledging the ongoing litigation and kind of what the dynamics may be with the incoming administration, and making sure that whatever is proposed aligns with those realities.
Right. The legality of what we're trying to do.
Okay. 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 Anybody else? Or are there solutions that were discussed after you heard today in these past few meetings that you're gravitating towards or that you feel like is off the table? What can help us get to increasing coverage in a way that's efficient and acknowledges or makes an efficient use of taxpayer dollars?
One thing that I wanted to just put forward, I thought the gentleman from Georgia that did the presentation today was interesting.
Mm-hmm.
And one thing is just the concept of moral hazard, and basically it's sort of a skin in the game idea. So, you know, if you have skin in the game, you care a lot more about what's happening, and if you don't, sometimes you take it for granted. And so, you know, for example, there are different ways to do that. I mean, some ways are financial, and some ways are more interactive. Like he was talking about the digital interactions thing. So I think focusing on health coverage is great, but also focusing on health by making sure that there are different ways to keep people that utilize this engaged, and that they actually have some skin in the game, which is whether it's interactive or some degree of financial involvement, so that they really do care about what happens. I thought that was interesting, and trying to kind of marry those ideas. I thought it was an interesting way to think about it.
Okay.
And Senator Woodard, so if you were to ask John Snow, who's one of your guys over there at Granville, you know, what would be important to him in regards to making sure that he was able to take care of people, which, you know, is part of, you know, improving the access to care? I mean, what would, you know, John's not a bashful guy. What would he say to you?
Probably give me a, well, I don't know. Let me think about that, Steve. Because he would drill down beyond these guiding principles and really get very strategic, I guess. So
Yeah, and you know, I think you're right, and you know, my point is that, you know, whatever we do has to be able to be actionable to the people who are doing the work, and
yeah,
you know, I think that's,
I
you know,
kind of been quiet in this section because I'd love to hear what you all are. I mean, some of you are practitioners and represent various groups. I'd love to hear what y'all think, because whatever we leave with, I'd like to have a set of tools that we get to work with, because in the end, most of how we go forward is going to be crafted in this building right here, and obviously with consultation from the governor and Secretary Cohen and others, and you all will certainly, some of you various ways will be part of that conversation, but it seems like we're the recipient of the deliverable here. Sound like a consultant now, but and this is a question I had for the secretary a few weeks ago, and I had a call with her and Dave Richards. I'm like, what's the deliverable? What at the end are you handing over to the policy makers, the decision makers? And like I said, mostly that's us. So, you know, you're giving us a great set of principles here, but where do we go with it, I guess? And ultimately that's our decision. But so, and then to get back to your question, Steve, what are the John Snows and the David Zolkowskis and the Tom Owens of the world, all in my district, 3 very different hospitals, as you know. You know, what do we end up giving them to work with, as well as other providers out of this?
Yeah, and I think that's a great point. And you know, one of the beautiful things about North Carolina, it's not a homogeneous state. You know, I mean, you know, as you said, I mean, you've got, you know, Tom Owens, who runs one of the finest medical centers in the country, and then you've got, you know, John Snow, who's busting it every day to make it work in a small community hospital. So, I do think, kind of understanding that, North Carolina is not homogeneous. There's not a one size fits all approach, and the approach has to be scalable, and it has to be able to be implemented within the uniqueness of different communities and geographies.
Okay. And so, Senator Woodard, you mentioned tools for legislators to work with. What would help you or and your colleagues in this effort? What sort of tools? Is it just like fact sheets, or like just what are all, like a list of everything you could accomplish? What would be helpful for you?
Well, I mean, in our goal is to develop these principles, right? I mean, that's the thing we're trying to reach consensus on, is that this council adopted whatever number this is, 10, 11 principles for the decision makers, for the policy makers. I don't know. I mean, I always like getting down in the weeds and start hammering this out. So, I mean, I wish we were able to reach consensus around a few more specific things
Okay.
that we talked about. But, I know that's going to be very hard without more meetings and real difficult conversations. I can't think of a better adjective for that, but, where we have some consensus around specific policy directives. And that's going to be hard. I understand that. That's why guys like me and Donnie Lambeth, who just hopped on, we sit around here for week after week and sit in hours worth of meetings hammering this stuff out. So, and why guys like Steve Lawler and Andy Allen come and visit us and lobby and talk about these things. But I'm not giving you a solid answer, but consensus around some of the things. I mean, are we committing to some kind of expansion of Medicaid? I mean, I'd love to know that. And can we reach some consensus around that if it's 100% and not 138? What if, we all agree that we expand it for expectant mothers, those kinds of things.
Okay.
That we've talked about and had some presentations on. I have a number of issues around supporting small businesses. And again, that's not the purpose of this council, but I mean, we need a lot more conversation around health plans for small businesses, because I've been working with a group of small businesses in my community, and they're really struggling trying to come up with healthcare options for their employees. They're not able to attract or retain good employees because they're 4, 5, 6 people, and they don't fall into some of the buckets where we've had association plans, and we need broader use of those things. So anyway, I'm not giving you a real answer, but
to Senator Woodard's comment, I mean, I do think, looking at, current, policy and statutes that enable better cover. I mean, so I think looking at currently what's law, or what are North Carolina statutes, especially, within the Department of Insurance. I mean, so, in addition to, associated plans, I do think, creating greater flexibility for provider-led networks to contract directly with employers to help fashion, health coverage plans, and not necessarily, folks want to be, insurance providers, but the people that are taking care of folks, in many cases are the best people to help design and develop a plan for an employer to help keep their people healthy as well as their family members. So I think some flexibility in that space probably is meaningful as well, because I think some of the current insurance laws in North Carolina, clearly define what a health plan is and what's not. We just may need more flexibility so people like Tom Owens or John Snow could work together to offer a coverage plan or at least access to care for small employers.
Okay. And Julia, do you have anything in response to that, since you probably have the bolus of knowledge, existing statutes and policies?
Not particularly on that, but I did have just a follow-up question on the employer discussion, because it just is making me think about, because I was just looking back at the bullet on supporting the business community. And so I just want to make sure I understand. So it seems like a multi-pronged issue. One is the ability of small businesses to compete with other businesses because they're unable to offer coverage because of the cost and other considerations.
Or that there's just not a product available to them.
Right. I'm just wondering, looking at that bullet, do we need to add anything about healthy workforce? Or is the issue really about small businesses being able to offer coverage?
If you look
I think
at
it's both.
that we got with our documents the other day, it was pretty, the difference between the under 50 employee and the over 50 employee, whether it was premium, deductible, whatever it was, as Senator Woodard mentioned, there was a sizable gap between the two, which means if you are under 25, 50 employees, you have a hard time keeping those employees when they're going to have to spend $400 more a month, let's say, to cover their family, rather than in a large employer. So if you're trying to attract talent, it's hard, because even if you're paying them at the same amount or even just a little bit above, that employee is still losing. And I mentioned this to Senator Woodard also. I think also there's a disconnect sometimes with employees of what the cost of the healthcare is. I told Senator Woodard, when I've had employees leave and I show them what their COBRA amount is per month, their jaws drop. And they don't always connect the dots of how expensive, although we tell them every year what it costs, they don't always connect the dots of how expensive it is for healthcare. But I think that chart was, with all those differing over 50 and under 50 was really telling the other day of, as Senator Woodard mentioned, the situation that many small businesses are in. And as I think I mentioned too, with COVID, I think you're going to see many more small businesses where people took a buyout, they got laid off, they started a new business, and they went from being with an employer where they had coverage, and now they're starting anew in the individual market or in a small group market, and they're trying to find coverage. And it's a little different, maybe even in finding it in Wake County versus finding it in Caswell County, of finding that product, to Senator Woodard's comment.
Okay, that's helpful. I was also interested in your reaction to Georgia's plan, where they're helping to pay for employee premiums for low wage workers. But I guess that doesn't do anything for employers that don't have a product to offer.
Right.
Hey, let me jump in here too. Sorry I got knocked off, but had a little trouble getting back on. We have to be realistic, I guess, with the current General Assembly in terms of the expansion, the traditional expansion. And I just don't think that's an option. So we have to be very creative in thinking about improving access and what might work. And I did like lots of the aspects of the Georgia option, although it seemed like a lot of effort for very few covered lives. And it seemed very expensive for very few covered lives. But I liked certain aspects in terms of the incentives towards wellness, things like that. And I think that's part of a design that, we've been trying to come up with here in North Carolina. I think we have to, while thinking about improving access, I've been trying to think outside the box. And I know we have to come up with waiver requests. I know the environment now in Washington's changed. I've been toying with this notion of an idea of a healthcare voucher, kind of like the education voucher, where we would actually provide individuals funding that they could go into the private market and buy coverage. Don't know whether that's going to be something the colleagues of mine would be interested in, but I think we have to be even more creative than we've seen in some of these other states if we're going to move towards improving access for some of these individuals. Healthcare is extremely expensive. You know, it's the best in the world in some respects, but there's so many inefficiencies in healthcare and duplication of services and quality estimate. And those are the kinds of things that we have opportunities, I think, to improve on to change the cost curve some. But healthcare is expensive and there's no way around that.
Mm-hmm.
We have to figure out a way to make it more efficient. And I think there are some things that we've talked about, telemedicine, primary care. I mean, it amazes me coming out of the healthcare profession that we haven't really focused on primary care and the wellness aspects. I mean, I'm still amazed at how many people don't get their routine screenings, which could save hundreds of thousands of dollars later if they'd done something preventive early on. And so we still have a lot of education in this country to emphasize upon people the hazards of smoking, the obesity crisis that we face. Those things all add up to ultimately very expensive healthcare bills. And, you know, overutilization of the emergency room. It is amazing when you look at the breakdown of Medicaid patients and how many use the emergency room for their primary care. Well, as Steve Lawler and others know, the most expensive site is the emergency room. If you go in for a headache, you get an MRI. I mean, that's just the way it works. I don't have the answers, but I think we have to keep kind of working through some of these issues to try to find the right formula that's going to find a solution to some of our challenges. We have to figure out how to get more people covered because the level of uncompensated care is just unacceptably too high. And that's, I think, part of our challenge is trying to figure out what's the right formula that everyone can get to the table and come up with something that actually makes some sense. There are aspects of the Georgia model alike, but then it seemed like a lot of effort, a lot of cost for very few people.
So, Donnie, question. I think that's I thought that was, great points. Do you think, or do we think as a group that flexibility in plan design, and in many cases, those plans that are either provided or funded by, federal dollars or certain elements within the plans that you have to have, which in many cases leads to a pretty rich plan that's fairly expensive.
Yeah.
So is, flexibility in plan design an important aspect to take into consideration as we do this work?
Yeah, I actually think it's a very important aspect because I think plan design can begin to change some habits and incentivize people to certain aspects of healthcare, again, along the area of wellness. So I think that's an extremely good point as we think about what's the right formula, what's the magic answer here to get this, working.
I really like this conversation. We have 45 seconds left. And so I just wanted to let you all know I will be sharing the screen when we go back out into the larger group. Merritt, this will be up, so hopefully you can walk through this, but it just needs to be reflective. Whatever you say, just reflective of the general consensus. And it sounds like there might be a need for more conversation around action. So these are around principles, and maybe there's an opportunity to have some sort of ongoing conversations around very targeted solutions that we can all get behind, and that legislators can kind of say, okay, this is maybe the direction we want to go in. Thank you all for sharing your thoughts, and we will be in touch soon.